Your breast is fascinating. It sits on your chest wall and it changes throughout your life in response to your hormones. So it changes during puberty, your periods, pregnancy, breastfeeding, and the menopause. In this video, we're going to talk about 8 signs on your breast that you shouldn't ignore. Before we start, are you able to name all of the parts of your breast? Here's the roadmap. Can you find your way? Your breast is shaped like a teardrop. The raised projection at the front is the nipple. The darker circle around the nipple is the areola, and those small bumps that you sometimes see around the areola are oil glands, also known as Montgomery glands. This is the body of the breast, and the tail, which points towards the armpit. So the breast actually sits diagonally like this, and not like this, how it's commonly portrayed. And finally, the crease at the bottom where the breast meets the chest wall is called the breast fold. Now, let's talk about those 8 signs that you shouldn't ignore. Okay, so first let's start with the inverted nipple. This is when the nipple points inwards or is folded like a horizontal crease. And it's actually quite common. Some people have had an inverted nipple all their life, and it's usually nothing to worry about. In fact, in some situations, it can come back out. But if you develop a new inverted nipple, you should see your doctor. Flaky rash. A flaky rash around the nipple or areola may be a sign of an underlying issue. The rash can be itchy, red, sore, cracked. It can spread outwards and it can even be weepy. So it can look like nipple eczema, but it may be more than just a skin issue. Tethering. Tethering refers to the pulling in or drawing in of the skin, making it look like there's a dent in the breast, and it can be more noticeable when you raise your arms above your head. It could be a sign of an underlying problem in the breast, so don't ignore this. Dimpling. This is where the skin of the breast has multiple dips, so it kind of looks like the skin on an orange, and that's why it's called peau d'orange sign. I hope my French pronunciation is not too bad on that. So it happens because of thickening and swelling of the skin, which then accentuates the pores. If you see this change, please have it checked out by your doctor. Redness or heat. Feeling an unusual warmth in your breast or part of your breast could be a sign that something is not quite right. Because the warmth can be associated with tenderness or redness, it can sometimes feel like an infection. In women who are breastfeeding, it is not uncommon to have a single hot breast which is painful and red, and this is called mastitis, and it's due to the fact that bacteria can manage to enter any sores or cracks that have developed around the nipple from breastfeeding. It is more concerning though if you develop a red sore breast when you are not breastfeeding. Nipple discharge. Nipple discharge, meaning fluid coming out of the nipple, can be due to various causes, and this nipple discharge can come in a variety of colours, which can sometimes give a clue as to what the underlying cause may be. The discharge can be yellow, green, milky, white, clear, or even blood-stained, and it can affect one or both nipples. Sometimes it's spontaneous, meaning that you might just take off your bra and then you see that there's a stain inside, or it can occur only if the nipple is squeezed. Don't ignore this sign, especially if it's from one side only and you are not pregnant or breastfeeding. Change in size. Our bodies are naturally asymmetrical, and many women have uneven breasts, meaning one side is usually a different size or shape to the other. And this can be completely normal. However, if one of your breasts suddenly changes size or shape, don't ignore this. A breast lump. Breast lumps are relatively common and they can feel different to your normal breast tissue. So they can feel quite firm or hard, smooth or irregular. And if you try to move them, they can sometimes be mobile or fixed. And it can be quite hard to know if you're feeling a lump because sometimes breasts are quite lumpy, especially in the upper and lower outer parts, and especially in the 2 weeks before your period. So the best time to feel for a lump is a few days after your period has ended. Now, not all lumps are harmful, but if you do find a lump, it's crucial that you get it checked out. A persistent lump in the armpit or around the collarbone could also be a sign of an underlying problem in the breast. These 8 signs that I mentioned don't always mean that there's something wrong, but sometimes these signs we talked about could indicate a breast cancer. If you notice any of these 8 signs in your breast, don't panic, but do make an appointment to see your doctor. If you want more information, check out the links in my description and check out my colleague, Dr. Liz O'Riordan. She's a breast surgeon, an author, and has had breast cancer herself, and she makes the most incredible content on breast cancer and breast awareness. If you learned something new, leave the graduation emoji and tell me what it is in the comments.